Good afternoon and welcome to our weekly news conference. We're in a different location today. We'll explain why. At the end of the news conference, we're going to invite the media to take us a quick tour of one of the facilities here inside the building. The mayor will explain. We'll take a few questions before we take that tour. And with that, I will turn it over to the mayor.
All right. Good afternoon, and as always, thank you for joining us for our weekly press briefing. Melissa said that I would explain, but I'm actually going to step aside and give an opportunity to our Director of Human Resources, Ms. Toya Martin, so that she can explain what brings us to 633 today. Thank you, Toya.
Thank you, Mayor. Good afternoon. The city has partnered with Medical Analysis to provide a health center for our employees and their family members. The clinic removes the two major barriers that our employee faces when it comes to health care: cost and convenience. The clinic is not open to the general public. It's open to only our employees and their family members. And it's also no cost to those employees and family members when they visit the clinic. We have noticed a significant decrease in our claims, and we have also looked at the data and the statistics of our employees, and we have noticed that they're healthier employees since we've had our clinic. The clinic is open to all employees, and there's a number of services that our clinic offers to our employees. It's ran by two healthcare nurse practitioners and also medical professionals as well. Our clinic also is a occupational health center for our employees, where they do all DOTs, drug testing for all of our new hires, and also physicals for police and fire as well. None of that is billed to our insurance carrier, so again, we've noticed a major decrease in that. It's also a powerful tool a powerful recruitment and retention tool for our employees, which really helps us when it comes down to recruitment. And I want to talk about, we have a career and job expo for candidates on June the 6th from 10 to 2 at the Jackson Medical Mall. We'll be there. My Department of Human Resources is hosting this event at the Medical Mall. We'll be doing on-the-job hiring, on-the-job interviewing, and we'll be doing screening for our employees as well. We also will be having Dress for Success there. There'll also be a vendor that we have partnered with that will be doing, interview techniques for candidates. So we ask all candidates that are looking for positions. We have a bunch of vacancies that we're trying to fill. Police recruit, fire recruits, and the age for fire recruits are 18 and up. We're looking for public safety dispatchers, a civil engineer, signal technicians, zookeepers, equipment operators, emergency vehicle technicians, and those are the guys that actually are women that fix our emergency vehicles. So this is just some of the positions, but we have a number of vacancies that we're trying to fill, and our goal is to go ahead that day and interview and go do on-the-job hiring on that day. So we invite everybody out. Again, it's June the 6th, 10 to 2 at the Jackson Medical Mall. Thank you.
I want to commend Toya for the great work that her department is doing, and for all individuals, people who stop me in the streets and often say that either they or a family member are in search of a job. I encourage you, when they stop me, Toya, they don't tell me what their skill set is. They don't tell me what area of work they're in. And so I'm supposed to just reach in the sky and find something. So we encourage people to go to the website so that you know what your skill set is and you know what's available, so you can match your skill set to the work that we have available. There was once a time where you had people in search of jobs. Now you have jobs in search of people. The city is no different in that regard. I also want to speak to the importance of the reopening of this clinic and the importance of the facility that we're in. This 633 location and this clinic are all consistent with our investment in the soft infrastructure of the city of Jackson. We talk about the roads, we talk about the pipes, but we don't often talk about the investment in the men and women who work for the city each and every day and we expect efficiency in their work. We expect proactivity in the things that they accomplish on the behalf of the city of Jackson. And so our expectation or our requirement of ourselves needs to be that we provide dignity in the work that they do each day. You should have a work environment which is conducive to the output that we desire. 633 is a upgrade from the work conditions that our employees were formerly in. The clinic that you're going to tour today, you will see resembles a clinic that any of you may go to in your private lives, or that your businesses may have available to you. And so we want that to be helpful to our residents. That is why we've been making significant strides to increase the salaries of many of our employees, and we're not satisfied yet. We know that we've made increases in the public safety sectors. We know that we provided 100% coverage of the healthcare premiums of all of our city employees in the midst of a pandemic. We did that not only because it was our way of demonstrating our compassion and the value that we have in our employees, but it was our way of providing more take-home pay to them without having to match it in retirement or match it in other benefits. And so that was a way that we were able to not only give them more money that they take home and put on the dinner table for their families, but it was also our way of reducing our own costs. So when we have good healthcare policies, when we have a clinic that functions as Toya spoke to, then it reduces the cost of the city. So it's a win-win for everyone. And I want to commend her for the great work that they're doing. I'm going to shift the page to a few other items that we have for you before we go on our tour, as we previewed for you. One of those things is with our Parks and Recreation Department. We're calling all youth ages 15 and under to participate in the Jackson Zoo Youth Fishing Rodeo. I wish that we had our Parks and Rec Department director here available today, but we didn't have him available, and we will make him available to you later. He can certainly give you more details on what a fishing rodeo is, but as I understand it, youth can bring your fishing tackle and bait. Bring your own, I guess. Is that what they should do? And there are prizes awarded for catching tagged fish. So this is a nice recreational activity for our young people. I know that we have parents that are looking for something to engage their children in for the summer. And so we encourage you to bring them to one of the various things that we have put forth for our youth this summer. And that is our youth fishing rodeo, and that is ages 15 and under. And for more information, you can contact our Parks and Recreation Department. I know that many of you are very much in tune with the challenges or the concerns over our JTRAN fleet and making sure that our routes are sufficient. I did have a meeting with the bus driver union last week. I would describe that meeting as productive. I'm grateful for not only their willingness to sit down, but outline the challenges as they see them. I am taking, to be clear, they are not employees of the city of Jackson. They are employees of our third-party management group, which is MV. And so what I have committed to is to sit down with both sides collectively. I sat down with each side individually, and now we're looking to bring them together so that we can act as a mediator, quite possibly, between the issues that they have. We've encouraged their legal representation to be in the room so that we don't stand, incorrectly in the position of some legal entity trying to negotiate these issues, but that hopefully, because the city has an interest in a productive and well-run mass transit system, hopefully we can come to some resolution to those challenges as we see them. So I'm grateful for that meeting. I'm grateful for the meeting of both parties. And while the meeting between the parties collectively will not be open to the public, we look forward to bringing to you the results of that meeting once it takes place. I want to announce that we have 2 town hall meetings coming up. The first is to give residents a chance to air their concerns and ask questions of city leaders, and those may be general questions, and one may be dedicated to the issues related to water. We've had a significant uptick in residents reaching out about water bills, their concerns around water, or maybe not having pressure at certain times and wanting to speak on those matters. And so we will open that up to the public, and we're inviting residents who have received those high water bills or any concerns over meter or issues surrounding drainage to attend that meeting. So please stay tuned for an update on the dates for that meeting. We're looking to do that in the very near future, and we will announce that. With that, those are all the prepared remarks that we have. We're going to go on the tour in a minute. Okay, we'll introduce them in just a moment. Before we take our tour, we'll let you introduce yourself, and then we'll go on our tour.
Mayor,
Yes.
any comment on the FBI raids that took place last week, folks?
I don't have any information on them, so I have no comment on them.
Can you tell us if you were in any scope of investigation when you talked to by federal agents? Have you been any?
There was no raid on my home or anything like that, but other than that, I have no comment. I have no knowledge.
I know they went to City Hall. If you can tell us about agents at City Hall.
I can't tell you anything. I don't know.
What is your message to Jackson residents who saw video of agents raiding the district attorney's office? Is there anything you can tell us about what your state?
My message to Jackson residents is to stay tuned, with the business of the city and their personal lives. I don't have any information to give them in order to direct them what to think or have any message. I have no information whatsoever on the district attorney or anybody else. Yes, sir.
Is there a name for the clinic?
City's employees.
The city employee clinic. We're keeping it pretty basic,
Straight to
right?
the
Do you have
point.
any suggestions for any?
We could name it Charlie Drape.
We'll think about it. We'll put it. We'll put it in the
I'd be
queue.
honored. And secondly, when did this open?
So you want to speak to its initial opening and now the reopening?
Right. So yes, thank you for that question. This is actually a reopening because again, when the clinic first opened 7 years ago, it was located at the Metro Center Mall. And the space was very small. They only had space for one exam room and a very small waiting room. So they've been with us for 7 years, but this is a grand reopening where they're going to show you they have they went from one exam room to 3 exam rooms. They have a nurse's station, have a big waiting room. So yes, they've been with us for 7 years.
Okay, and so you kind of answered my question. But this is the building that city employees move to from Metro Center Mall.
Correct.
Is the heat, is the cooling system out in here?
It's a little warm in this room, but we've already made some calls to maintenance, so they are working on it right now.
But would you say, and maybe you've gotten from employees, that this is a better setup?
Oh, absolutely. This is a much better setup than Metro Center. Like the mayor talked about, it helps with employee morale, it helps with employee health. So yes, this is a much better place than where we were.
And then just last one, when is the meeting between the city and the MD Transportation and the union?
So all I can tell you is that it'll be in the very near future. I actually have to go out of town towards the end of this week, so this week is not conducive. We'll be looking to do it maybe as soon as next week, but we have to align the schedules of all of the parties, not only my schedule, but MV's leadership and the union leadership, to ensure that everyone can be at that table.
And did the union say anything about other potential sick outs or?
No, they didn't say anything about any other sick outs. They want to make certain that they just have a willing ear towards their challenge and their challenges. And I think that without seeming impartial to any side, I think that there were legitimate issues raised. And so we're going to speak about those issues with both parties.
Thank you.
I'd like to ask if Mr. Todd Garlington will come forward, and he is the president of Medical Analysis, who operates our clinic. Thank you.
Thank you.
All right, thank you.
Thank you, Mayor. Thank you, Toya. Yeah, so we've been working with the city for about 7 years now. We are thrilled, to say the least, to be in our new location, as you'll see here shortly. I have to chuckle, Mayor Lumumba, when you mentioned it looks like a clinic now, and it actually does, because we saw a lot of folks and took care of a lot of people at Metro Center, but we're blessed and thankful to be able to share this space with you guys here at State Street. We're a Mississippi-based company. We've been in business for about 25 years. We service pretty close to 40 clinic locations in Louisiana, Mississippi, and into Tennessee. We started, I guess, in February of 2019, and basically it's out-of-the-box healthcare. As you all know and you deal with daily and regularly, Toya, healthcare rates continue to skyrocket. This provides an opportunity for a non-claims-based traditional primary and acute care and occupational medicine health center, but we're not billing insurance for it. And so your employees and family members who are eligible, which means all employees and family members who are on the health plan, have access to the clinic, no copay, no deductible. So it opens the door for folks to be able to come in and access health care who otherwise may not have, because copays have gone through the roof. I see them as high as $75 per visit for primary care. And when you remove that, then you're allowing someone to still get health care and also have groceries for that week possibly. It's a lot of money to spend. So when you eliminate that, folks come. So the occupational medicine side of it is pretty big as well. We're doing a lot of DOT physicals for your fire and police department, which is included in our fixed fees for the clinic at no additional charges. They're able to get in and get out really quickly. And its average wait time right now is less than 15 minutes. And if you know, during sick season, sometimes it could be a half a day off work. So time away from work, we see really drastic improvements in time away, and people get in, see the physician, and get back out. So that's a real quick summary of who we are and what we do and how we do it.
Can add one last thing, not only about this clinic, but about 633. I'm going to choose my words carefully because you know that there is a legal proceeding based on our moving from our previous location. But I will say that it is important that when we have expectations of what we want to see in terms of efficiency with our work, that we have an environment which is conducive to working. And it says a lot to the employees if their work environment is not clean, is not comfortable, is not run efficiently. And we, at the same time, have an expectation of what we want from them. And so we're happy to see that. I'll tell you that when I arrived at my office almost 7-8 years ago at this point, I didn't have a conference table in the room that we meet all the time. And so I personally purchased a conference room table because I wanted people, when they come to the mayor's office, to understand that it was a place of business, that there were going to be critical discussions, and we've had many in that space. And so the same needs to be said for all of the individuals who provide hard work and their genius to the city of Jackson each day. So now with that, I would invite you all to the Charlie Drape Medical Clinic, right?
That's on the record.
Yeah, no.
Put that in the TV.
So I think if you can, I don't know how you need to move your cameras, but we certainly like to show you how the employee clinic is up and running. All right, thank you.